Dull.
What about now?
Sharp. 2. No. Left.
Hi, Andrea.
Hi.
I'm Dr. Matt. I'm going to do your annual checkup today.
Nice to meet you.
Nice to meet you too. May I please have your last name and your date of birth?
Miller. Date of birth is December 7th, 1982.
Perfect. Do you have any allergies?
I do not.
Okay. Are you taking any medications on a daily basis?
Just vitamins.
And when was your last checkup?
About 6 months ago.
Okay. Are you experiencing any pain at the moment?
I do have headaches once in a while,
Okay.
especially on the back of my head.
And are they constant or they come and go?
They come and go.
And you said it's been going on like this for a month, right?
Yes.
Okay. Are you taking any medicine for this sometimes?
I do take ibuprofen once in a while, but I try not to that much.
Have you had any surgeries or any accidents in the last 12 months? Okay. Any family history of headaches or neurological disorders?
Yes, my mom has migraines.
Okay. And do you remember when she was diagnosed with that?
Oh, a long while ago when I was little.
Okay. All right. We're going to go ahead and take your vital signs and do a checkup to see exactly what is triggering your headaches.
Okay.
I'm going to have you just take the blood pressure. This is going to go over your arm. Let's go ahead and use that one. Yeah. Okay, go ahead and relax. All right, I'm going to have you relax. Blood pressure is a little bit on the low side, 95/60. Are you feeling
I always
okay?
had it on the low side.
Okay. I'm going to take your temperature. It's going to go over your forehead. 98.7, that's perfect. Just going to go on your fingers, going to measure your oxygen and your heart rate. That's perfect. And the oxygenation is 95% on room air. Perfect. Okay. Okay, I'm gonna put gloves on and I'll do an eye examination. Sometimes headaches can be triggered by vision changes that are not expected. So we're going to do an ocular reflex test. I'm going to have you look straight right here in my nose. Just try not to blink. Good. Good. So that's normal. Go ahead and look straight at my nose. I'm going to flash a light in your eyes. We're just looking for pupil dilation and constriction. Okay, just going to lower on your eyelid a tiny bit. Just looking for any redness. Go ahead and look up. Okay. All right. I'm gonna have you follow the light with your eyes only. Don't move your head. Okay, now I'm going to bring the pen light very close to your nose. I'm going to have you follow the tip of the pen light. One more time. Okay. Now I'm going to have you look right over here, a little bit higher. And same thing on this side. Okay, no ocular movements, that's good. Okay, I'm gonna have you change into a gown and I'll have you lay down on the table and we'll do a full body exam.
Okay.
Okay, Andrea, I'm gonna go ahead and first examine your face. So we're looking at the main muscle points that could trigger a tension in the scalp and neck area. And that's some of the most common causes for headaches. Are you experiencing any pain with chewing?
No.
Just slowly palpating the sinuses in between your eyebrows. Looking for any tension, fluid buildup, tenderness. Okay, checking sinuses right under your eyes. I'm not noticing any fluid buildup. Checking lymph nodes for any lymphadenopathy. Looking at pre and post-auricular lymph nodes. Supplemental lymph nodes. Sublingual lymph nodes. checking trachea to see if it is midline or any deviations to the right or left of the axis. Palpating the thyroid gland for any nodules or swollen. I'm gonna have you swallow one time. Perfect. Checking supraclavicular lymph nodes for anything swollen. Checking mastoid bone for signs of mastoiditis. I'm just going to gently press down on your TMJ. I'm going to have you slowly open your mouth all the way up, all the way, a little bit more. Just a little bit of clicking there. Go ahead and slowly close it. And I'll have you do that one more time. Slowly open on the left side, right side. They're both clicks. Go ahead and close. We're going to run an MRI after this to check for any cartilage deterioration, to see what grade of disorder we have. It could be from 1 to 4, 4 being the worst. But since you're not having any pain yet, I would say it should be like a 2. And it's right on time. We can definitely treat this. I'm gonna have you keep your eyes closed and tell me what this smells like. I'm gonna close your right ear. And I'll have you breathe in through your nose and out. Are you able to identify this smell?
No.
Okay. Let's go ahead and check the right ear now. I'll have you breathe in. And breathe out. What does that smell like?
Alcohol?
Okay. Go ahead and check your taste. Have you noticed any changes?
No.
Okay. This is gonna go on the tip of your tongue. I'm gonna have you open and taste. Go ahead and close. Open. What does that taste like?
I don't feel any taste.
Okay. Just go ahead and try one more. Go ahead and open. Close. And open. What does that taste like?
Still nothing.
Okay. So let's go ahead and check your facial sensation. I'm going to touch you with two textures. The one is going to feel dull, and the other one's going to be sharp. This is what dull is going to feel like, and this is what sharp is going to be like. Okay. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp.
Does this feel the same as this?
Yes.
And does this feel the same as this?
No.
Does this feel the same as this?
No.
Does this feel the same as this?
Yes.
Okay, so that looks good. I'm gonna go ahead and check your scalp to see if there is any asymmetry or any skin abnormality. So first we're palpating to see if there are any lumps or bumps and checking for scalp symmetry. I'm going to turn your head to the right. I'm going to listen to your heart. Is it okay if I slide the stethoscope under the gown?
Sure.
Okay. I can hear only S1 and S2. No S3, no S4. I'm gonna have you take a deep breath in through your nose and exhale. Okay. I'm gonna check for murmurs. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Checking for any jugular vein distension. I'm not listening to any brewing, no signs of heart failure. All right. Scalp is on the dry side. Noticing a little bit of yellow discoloration and drier patches. I'm going to do a sensory test to see if there is any sensation loss on the left side. Go ahead and tell me if this feels dull or sharp.
Dull.
Was that sharp or dull?
Dull.
What about now?
Sharp. Sharp. Dull. Dull. Sharp.
Do you feel this dull all the way down?
Yes.
Go ahead and tell me how many taps you feel. 1, 2, or 3.
2. 2. 1. 3. 3. 2. 1.
Okay, does this feel sharp or dull?
Dull.
What about now?
Sharp.
And now.
Sharp. Sharp. Sharp.
Okay, gonna have you turn your head to the left. To apply a basic solution, it's going to help to remove the dry skin cells. We're going to make sure that we distribute this solution to the area that we want to collect the cells. this is a sterile cotton swab. We're going to collect what we were able to extract. We're going to send this to the lab. It's going to take about 24 to 48 hours that we get the results, and I'll let you know. Okay, I'm going to check your hearing now. So we want to see if there is any discrepancy between left and right. I'm going to create a tuning fork sound. Go ahead and tell me when you don't hear this sound anymore. You can just say no.
No.
Okay, good.
No.
Okay. Now go ahead and tell me if you hear which sound you hear louder. Position 1 or 2.
2.
Same thing on this side. Position 1 or 2.
2.
Okay. Now tell me with which ear you hear this sound, left or right.
Right. Right. Left. Left. Both. Both. Right. Left. Left. Right.
Okay, wonderful. So there is no impaction on the hearing, no hearing loss. I'm going to go ahead and check your abdomen, and let's see if there's any pain there. Starting with the left lower quadrant. normal bowel sounds. I'm not noticing any hyperactivity. I'm going to slowly percuss. Let me know if you feel any type of pain. And just a very slow palpation. Let me know if you feel any pain. We're looking for tension, rebound tenderness, and any swollen organs. Liver size is normal. Okay, perfect. No tenderness around the umbilicus area. I'm not seeing any redness, so no signs of peritonitis. Alright, I'm just gonna go ahead and lower the gown. Okay, so just slowly palpating to see if there is any asymmetry. Also looking at temperature. And if we're noticing any peripheral edema, especially looking around the ankles. Okay, I'm not noticing any diaphoresis, no swollen glands. Okay, pedal pulses are strong, 2+. Go ahead and tell me if you feel this vibration.
I do.
Okay. What about now?
I do.
Right. Go ahead and tell me when it stops.
It stopped. Stopped.
Okay. I'm going to take a few measurements. I'm just going to have you lift this up and relax. 65. I'm going to have you lift up and relax. Good. we're going to go ahead and check your reflexes. Okay, go ahead and relax your foot. Good. Relax. Good. Okay, I'm just gonna bend this knee over your left leg, just like that. Good. Okay. Same thing on the other side. This needs to be dangling just a little bit more. Okay, perfect. Okay. Let's check your Babinski reflex. Go ahead and relax. Just gonna feel a little bit of sharpness on the sole of your feet. Good. Okay, perfect. I'm going to check the strength of your legs. I'm gonna have you pull your feet towards you and as strong as you can. Okay, perfect. I'm gonna have you push in with your pads. Good. I'm going to slide my hands under your heels. Okay, I'm gonna have you push. Okay, a little bit stronger on the right side, but that's normal. All right, I'm gonna try to open your legs. Don't let me do that. Good. I'm gonna try to close them. Don't let me do that. Okay, perfect. And now I'm gonna try to push down while you're pushing up. Okay, good. Okay, a little bit weaker on the left side. I'm gonna have you tell me if you feel this all the way up.
I do.
Okay. And do you feel this all the way up?
Yes.
Okay. Does this feel the same as this?
Yes.
Okay. Do you feel this vibration?
Yes.
Tell me when it stops.
I do.
Okay. Same thing. Tell me when it stops.
Stopped.
Good. Okay. Very normal results. I'm gonna have you flip over now and I'll take a look at your back. Going to listen to your lungs. I'm gonna have you take a deep breath in through your nose and slowly exhale. And again, breathe in and breathe out. No signs of pulmonary edema. I'm going to percuss. Going to palpate cervical spine, starting with atlas. moving down 2 axes. C3 and C4. Looking for any deviation of the spine to the left or right. No signs of scoliosis or lordosis. I'm going to check skin turgor. This helps to determine if there is good hydration and nutrition. I'm going to check your skin. I'm going to take a few measurements. We're checking for asymmetry. Okay, this is going to feel like a benching sensation. Checking for skin turgor again and any asymmetry in the left or right. The right side definitely looks better. I'm going to check your neurological responses. I'm looking for any internal deficits. I'm not noticing any abnormal responses. Okay. I'm going to draw a letter on your back. Go ahead and tell me if you can identify it.
N. B. C. Z. M. D. R.
Okay, perfect. I'll have you sit back up on the table and we'll do one last checkup. I'm going to check your reflexes. So what I'm going to do is I'll slowly tap on your chin. I'm going to have you relax. Relax your chin a little bit more. Slightly open. Good, there you go. Okay. All right, I'm going to have you relax your arm. Okay, a little bit diminished on that side. Go ahead and relax. I'm going to have you flop it like this. Good. Good. Relax. Okay. Good. Okay. Okay. All right, now I'm going to have you put your arms in front of you, just like that. So I'm going to have you squeeze my fingers as strong as you can. Okay, good, bilaterally. I'm going to push down on your arms. Don't let me do that. Good. Now I'm going to try to push them up, but don't let me do that. Okay, weaker on the left side. I'm going to try to open them. Don't let me do that. And close. Okay, I'm going to have you spread your fingers out like that. I'm going to try to close them. Don't let me do that. Good. Spread them out. Okay. Okay, good. Go ahead and relax. I'm going to have you shrug your shoulders like this. Good. And now I'm just going to press on this side of your cheek and I'm going to have you resist. Okay. Good. Same thing on the other side. All right. I'm going to have you look down. Okay. Good. All right, Andrea. Everything looks good. I'm just going to run an MRI to see exactly how your TMJ looks. Okay. And I think that's where your headaches are coming from. I'm going to write all of this in your chart. So I'm going to make a new file for you and make sure that we have this information ready for the next checkup. Okay. And I will give you a call back with the results from the MRI, okay?
Great, thank you.
You're welcome. Very nice to meet you.